Hi everybody, this video of mine is about a very important topic, that is medical abortion. This is a procedure that uses medication to end a pregnancy. A medical abortion does not require surgery or anesthesia and can be started either in a medical office or at home with follow-up visits to your doctor. It is safer and most effective during the first trimester of pregnancy. Having a medical abortion is a major decision with emotional and psychological consequences. If you are considering this procedure, make sure you understand what it entails, side effects, possible risks, complications, and alternatives. The reasons for having a medical abortion are highly personal. You can choose medical abortion to complete an early miscarriage or end an unwanted pregnancy. You can also choose to have a medical abortion if you have a medical condition that makes continuing a pregnancy life-threatening. Now let me tell you some of the risks which are involved in medical abortion. These risks include incomplete abortion, which may need to be followed by a surgical abortion. There is a risk that an ongoing unwanted pregnancy if the procedure does not work. If the medical abortion procedure does not work, then there is a risk of continuation of unwanted pregnancy. Also, it could result in heavy and prolonged bleeding. There are some chances of infection and fever also. You may suffer from digestive system discomfort such as nausea and vomiting. You must be certain about your decision before beginning a medical abortion. If you decide to continue the pregnancy after taking medications used in medical abortion, your pregnancy may be at risk of major complications. So you should keep this thing in mind. Medical abortion has not been shown to affect future pregnancies unless complications develop. Medical abortion is not an option if you are too far along in your pregnancy. You should not attempt a medical abortion if you have been pregnant for more than 9 weeks. So this is a very important thing to remember. And how we calculate 9 weeks, it's calculated based on the start of your last period. The first day of your last period is calculated for 9 weeks. Some types of medical abortion are not done after 7 weeks of pregnancy. Usually we do not recommend medical abortion if the pregnancy is more than 9 weeks, but there are some other medical abortion types which we do not recommend which we do not recommend after 7 weeks. Or if you are having an intrauterine device, then it is also not recommended to have a medical abortion. If there is any condition or suspicion of pregnancy outside of the uterus, which is known as ectopic pregnancy. So in case of ectopic pregnancy, medical abortion is also not recommended, because there are some other procedures which are used to get rid of ectopic pregnancy. Okay. Or if you are suffering from certain medical conditions, such as those which include bleeding disorder, certain heart or blood vessel diseases, or if your liver or kidney are severely damaged, or if you are suffering from any lung disease, or you may be epileptic with uncontrolled seizure disorder. So in this situation, this medical abortion is also not recommended. Also, if you are taking a blood thinner or certain steroid medication, then in that case also it is not recommended. Or if there is a situation in which you cannot make follow-up visits to your doctor or do not have access to emergency care, then it is also not recommended, because during medical abortion there is a risk of excessive bleeding. So if you are if your emergency care is not nearby, or if you cannot access emergency care, then it is not recommended. Or if you have an allergy to the medication used in medical abortion, which I am going to tell you shortly. A surgical procedure called dilatation and curettage, which is also known as D&C in a shorter form, it may be an option for women who cannot have a medical abortion. So let's say if the pregnancy is prolonged, or if there are even if like in medical abortion, if your this abortion remains incomplete, then we have another option, that is surgical option, which is the last option to get rid of this unwanted pregnancy, or pregnancy due to some medical problem in which there is an indication of medical abortion. Okay. Now let me tell you something how you should prepare yourself. If you are considering a medical abortion, you should meet with your doctor to discuss the procedure. Your doctor will likely evaluate your medical history and overall health. He or she can confirm your pregnancy with a physical exam, or do an ultrasound exam to date the pregnancy and confirm it is not outside the uterus, that is ectopic pregnancy, and it is not a tumor that developed in the uterus, that is molar pregnancy. Doctor may advise some blood and urine tests as well. Doctor also explains how the procedure works, the side effects and possible risks and complications. Having a medical abortion is a very serious decision. If possible, you should talk with your partner, family or friends. Talk with your doctor, a spiritual advisor or a counselor to get answers to your questions. Help you weigh alternatives and consider the impact the procedure may have on your future. Keep in mind that no doctor is required to perform an elective abortion, and that in some states there are certain legal requirements and waiting periods you must follow before having an elective abortion. If you are having an abortion procedure for a miscarriage, there are no special legal requirements or waiting periods required. Medical abortion does not require surgery or anesthesia. As I told you before, the procedure can be started in a medical office or clinic. A medical abortion can also be done at home, though you will still need to visit your doctor to be sure there are no complications. During the procedure, medical abortion can be done using the medication which I am going to tell you. So now I am coming to tell you to list of medication which are used in medical abortion. The first, which is very popular option, is drugs known as oral mifepristone, that comes with the name of Mifeprex, and oral misoprostol, that comes with the name of Cytotec. This is the most common type of medical abortion. These medications are usually taken within 7 weeks of the first day of your last period. Mifepristone blocks the hormone progesterone. So I'm telling you the mechanism of action, how this mifepristone works. So it blocks the hormone progesterone, causing the lining of the uterus to thin and preventing the embryo from staying implanted and growing. And the misoprostol, which is a different kind of medicine, causes the uterus to contract and expel the embryo through the vagina. If you choose this type of medical abortion, you will likely take the mifepristone in your doctor's office or clinic. Then you will probably take the misoprostol at home hours or days later. You will need to visit your doctor again about a week later to make sure the abortion is complete. This regime is approved by Food and Drug Administration, FDA. I mean, this is the most popular procedure. The combination of oral mifepristone and oral misoprostol, this is the most recommended procedure approved by FDA. Then the next option is oral mifepristone and vaginal buccal or sublingual misoprostol. This type of medical abortion uses the same medication as the previous method which I just told you, but with a slowly dissolving misoprostol tablet placed in your vagina root, or in your mouth between your teeth and cheek, that is known as buccal root, or under your tongue, that is sublingual root. The vaginal, buccal or sublingual approach lessens side effect and may be more effective. These medications must be taken within 9 weeks of the first day of your last period. Then we have a third option which is not commonly used, but let me tell you this. This is methotrexate and vaginal misoprostol. Methotrexate, which comes with the names of Otrexup or Rasuvo, is rarely used for elective unwanted pregnancies, although it is still used for pregnancies outside of the uterus, which are ectopic pregnancies. This type of medical abortion must be done within 7 weeks of the first day of your last period. and it can take up to a month for methotrexate to complete the abortion. So you should keep this thing in your mind. Methotrexate is given as a shot or vaginally, and the misoprostol is later used at home. And there is a fourth option as well, that is the vaginal misoprostol alone. Vaginal misoprostol alone can be effective when used before 9 weeks of gestation of the embryo, but vaginal misoprostol alone is less effective than other types of medical abortion. The medications used in a medical abortion cause vaginal bleeding and abdominal cramping. They may also cause nausea, vomiting, fever, chills, diarrhea, headache. You may be given medication to manage pain during and after the medical abortion. You may also be given antibiotics, although infection after medical abortion is rare. Your doctor will let you know how much pain and bleeding to expect depending on the number of weeks of your pregnancy. You might not be able to go about your normal daily routine during this time, but it is unlikely you will need bed rest. Make sure you have plenty of absorbent sanitary pads. If you have a medical abortion at home, you will need access to a doctor who can answer questions by phone and access to emergency services. You will also need to be able to identify complications. After the procedure, signs and symptoms that may require medical attention after a medical abortion include heavy bleeding. So now I am going to tell you the risks or complications which you may face, so that you should be aware of these risks. So heavy bleeding can occur. Soaking 2 or more pads an hour for 2 hours is known as heavy bleeding. Severe abdominal or back pain, fever lasting more than 24 hours, foul smelling vaginal discharge. So if you suffer from these kind of situations, then you should immediately contact emergency medical care. After a medical abortion, you will need a follow-up visit with your doctor to make sure you are healing properly and to evaluate your uterine size, bleeding and any signs of infection. To reduce the risk of infection, don't have vaginal intercourse or use tampons for 2 weeks after the abortion. Your doctor will likely ask you if you still feel pregnant if you saw the expulsion of the gestational sac or embryo, how much bleeding you had, and whether you are still bleeding. If your doctor suspects an incomplete abortion or ongoing pregnancy, you may need an ultrasound and possibly a surgical abortion. After a medical abortion, you will likely experience a range of emotions such as relief, loss, sadness, and guilt. These feelings are normal. It might help to talk to a counselor about them. Preventing pregnancy. Ovulation usually occurs as soon as 2 weeks after a medical abortion, and another pregnancy is possible even before your period begins. Before the abortion, talk to your doctor about contraception that you can start as soon as the procedure is over. So this was my video about medical abortion. I hope you have liked this video, and till now if you have not subscribed to my channel, please subscribe it and click the bell icon so that all upcoming videos are delivered to your inbox. And if you are facing this kind of situation, or if you are suffering from any other illness, please post a comment about your illness and I'll try to reply you as soon as possible. And if I get a time, I'll try to make a video on your illness. And if you think that my video provides some sort of benefit to you or your family, please like this video and share these videos through social media such as Twitter and Facebook, so that other people may get benefit from my videos. Thank you very much for watching this video. See you in next video. Bye for now.